What if one of the most stigmatized, least discussed habits in a man's life turned out to be, based on actual peer-reviewed research, one of the most protective things he can do for his prostate after the age of 50? What if a Harvard study tracking nearly 32,000 men for 18 years found that frequent ejaculation was associated with a 20% reduction in prostate cancer risk? And what if the silence around this topic, the embarrassment, the shame, the assumption that this habit is something to grow out of, has actually been keeping men in the dark about something their own bodies have been trying to tell them all along? Today, we're going to look at the science, not opinion, not folklore, not what your father told you when you were 13, the science. Specifically, what happens inside the prostate of a man who ejaculates daily after the age of 50, and what 25 years of clinical evidence has taught us about it. Let me begin with a quick biological fact, because before we can talk about what changes, we have to understand what we're changing. Your prostate is a gland about the size of a walnut, situated just below the bladder and in front of the rectum. It surrounds the urethra, the tube that carries both urine and semen out of the body. Its primary function is to produce prostatic fluid, a slightly alkaline secretion that makes up roughly 30% of the volume of semen and protects sperm during their journey. During ejaculation, the smooth muscle of the prostate contracts rhythmically, expelling that fluid into the urethra. That contraction is not incidental. It's mechanically and physiologically meaningful, and we'll come back to it. I'm Dr. Jocelyn, board-certified in urology, 25 years in clinical practice with a focus on men's health and prostate disease. And in those 2.5 decades, I have had this exact conversation with thousands of men, almost always whispered, almost always prefaced with an apology, almost always asked at the very end of an appointment, hand on the doorknob, eyes on the floor. Doc, one more thing. Is it bad if I... Today, I want to take that question out of the whisper and into the daylight where it belongs. Before we go any further, I want to give you a challenge. By the end of this video, I want you to commit to one specific change in how you think about or practice this aspect of your health. 21 days. That's the window. Drop your one commitment in the comments below, and yes, you can be discreet about it. The point is that you make it. Now let's begin with what the research actually shows. The first study I want to discuss is the one I mentioned at the start, Harvard. Nearly 32,000 men, 18 years of follow-up. The finding, men who ejaculated more than 20 times per month had approximately a 20% lower risk of being diagnosed with prostate cancer compared to men who ejaculated only 4 to 7 times per month. 20 times per month, gentlemen, is roughly 5 times per week. If a man is ejaculating daily, he's at 7 per week. He is squarely inside the most protective category that study identified. A separate Australian study found something similar with a sharper number. Men who averaged between 4.6 and 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before the age of 70, compared to men who ejaculated fewer than 2.3 times per week. That's not a marginal statistical signal. That's a meaningful clinical effect. And it has been replicated across multiple cohorts and methodologies. So the question becomes, why? What is the biological mechanism by which regular ejaculation appears to protect the prostate? Let me walk you through it, because this is where the science gets genuinely interesting. The leading hypothesis is what researchers call the prostate stagnation theory. Most men think of the prostate as a passive organ, a problem that shows up after 60. But the real issue isn't the prostate as a structure. The real issue is the prostate as a system. The deeper truth is this: your prostate is not a static gland. It is a continuously secreting, continuously active organ. It produces fluid every day, and that fluid is meant to move. When ejaculation occurs infrequently, prostatic fluid sits in the ducts. It stagnates. And like any biological fluid that sits stagnant in a warm environment, it accumulates metabolic byproducts, inflammatory compounds, and potentially carcinogenic substances filtered from the bloodstream. Over years, that stagnation creates a low-grade inflammatory environment that is precisely the kind of environment in which abnormal cellular changes can take hold. Regular ejaculation, and here is the simple, elegant logic of it, clears those secretions. It functions as a flushing mechanism. The prostate gets emptied, inflammatory compounds get carried out, the internal environment of the gland resets. This is not speculation. This is the most parsimonious explanation for what the epidemiological data has been telling us for over a decade. Let me give you a real-world clinical illustration. I had a patient, Edward, age 64, retired engineer. His father died of prostate cancer at 71. His older brother was diagnosed at 68. Edward came to me genuinely afraid. We had a long conversation about modifiable risk factors: diet, exercise, weight management, alcohol, and yes, ejaculation frequency. He had been married for 40 years, and intimacy with his wife had naturally tapered. He felt some embarrassment about the alternative. I walked him through the data the same way I'm walking you through it now. He went home, had an honest conversation with his wife, who, by the way, was supportive and informed, and adjusted his approach to roughly 5 to 6 ejaculations per week. 6 years later, his PSA has remained stable, his digital exams have been clean, and he tells me, without exaggeration, that he sleeps better, feels calmer, and worries less. That is one patient. It is not proof, but it is consistent with what the literature predicts. Now let me address something important, because the research is not one size fits all, and I am not going to oversimplify this for you. The age of the man matters. In some studies, very high ejaculation frequency in men in their 20s was associated with a slightly elevated risk of prostate cancer, possibly because that frequency reflected unusually high circulating androgen levels in a small subset of genetically predisposed men. But for men over the age of 50, the data flips clearly and consistently in the protective direction. The strongest protective effects in the Harvard data were actually seen in men in their 40s and beyond. So if you are a man over 50, the evidence does not support frequency. It supports informed, mindful regularity. Let's talk about what is physically changing inside the prostate when ejaculation occurs daily. There are 4 mechanisms worth understanding. First, fluid clearance. As I described, daily ejaculation prevents the accumulation of prostatic secretions and the metabolic byproducts that accompany them. This reduces intraductal pressure and limits the dwell time of any potentially harmful compounds. Second, vascular response. Sexual arousal and ejaculation produce a marked increase in pelvic blood flow. The prostate, like every other tissue in the body, benefits from improved perfusion. More oxygen, more nutrients, more efficient clearance of metabolic waste. Vascular health and prostate health are not separate conversations. They are the same conversation. Third, inflammatory modulation. Chronic low-grade inflammation is implicated in both benign prostatic hyperplasia and prostate cancer. Several studies suggest that regular ejaculation is associated with lower levels of inflammatory markers in prostatic tissue. The mechanism is likely multifactorial: improved drainage, improved circulation, and reduced cytokine accumulation. Fourth, muscle conditioning. The prostate contains smooth muscle that contracts during ejaculation. Like any muscle tissue, regular activation appears to support functional integrity over time. Disuse in any biological system tends to accelerate decline. These 4 mechanisms are not theoretical. They are observable in clinical practice, and they begin to explain why the epidemiological data looks the way it does. Now I need to give you the other side, because this would not be honest medicine if I only gave you the encouraging half. Frequency alone is not the whole story. Technique matters. And there are 5 specific mistakes I see in clinical practice that can turn a beneficial habit into a harmful one. The first is inadequate lubrication. Daily friction without adequate lubrication causes microscopic tissue damage to the penile skin and urethral opening. Over time, that microdamage produces scarring, reduced sensitivity, and what we call lichenoid changes. The fix is simple: a water-based or silicone-based lubricant, every time. This is not optional at daily frequency. It is essential. The second mistake is excessive grip pressure. Some men, as sensitivity declines with age, compensate by gripping harder. This is a self-defeating loop. Higher pressure reduces sensitivity further, which prompts even higher pressure, which causes tissue damage, which further reduces sensitivity. A lighter touch and varied technique is the better path. Your tissue is not meant to be subjected to pressures it would never encounter in partnered intimacy. The third mistake is what I call mechanical rushing. Treating ejaculation as a 30-second task to be completed before bed eliminates most of the physiological benefits we just discussed. The arousal phase is where pelvic blood flow increases. The buildup phase is where the prostate engages. The release phase is where the stress-modulating neurochemistry kicks in. 10 to 20 minutes is the appropriate range. This is your nervous system, not a microwave dinner. The fourth mistake is ignoring warning signs. Pain during or after ejaculation, burning during urination, blood in the semen, difficulty starting the stream. These are not normal. These are clinical signals that warrant a urology consult. They do not necessarily mean cancer. They more commonly indicate prostatitis or urethral irritation. But they require evaluation, not avoidance. The fifth mistake, and this is increasingly important in modern practice, is dependence on extreme or escalating pornographic content for arousal. This is not a moral statement. It is a neurological one. The dopaminergic reward system is plastic. Chronic high-novelty stimulation rewires it. And the downstream consequences, reduced responsiveness to partnered intimacy, compulsive patterns, difficulty with arousal in real-world contexts, are well documented in the clinical literature. If this describes your situation, the conversation is no longer about the prostate. It is about the brain, and it is worth having with a qualified clinician. I want to give you one more clinical case before we move toward the close. A patient named Marcus, age 58, came to me with chronic pelvic pain syndrome, persistent dull ache, mild urinary urgency, no infection on cultures. His ejaculation frequency had dropped to roughly once every 2 weeks due to relationship strain. We addressed several things: pelvic floor physical therapy, stress management, a gentle increase in ejaculation frequency to approximately every other day, and proper technique. Within 8 weeks, his symptoms had reduced substantially. The mechanism, I suspect, was a combination of improved prostatic drainage and reduced pelvic floor tension. Again, one case is not proof, but it is consistent with the model. Now, there is one more dimension to this conversation I would be remiss not to address, and it is the dimension I find most under-discussed in mainstream medicine. The prostate is not an isolated organ. It exists within a body that is also a nervous system, an endocrine system, and a stress response system. And every one of those systems is influenced by what happens during and after ejaculation. Ejaculation triggers a measurable cascade of neurochemistry. Dopamine, which mediates reward and motivation, surges and then settles. Oxytocin, which is associated with bonding, calmness, and reduced cortisol output, is released. Endorphins, the body's endogenous analgesics, are released. Prolactin rises and contributes to the post-orgasmic refractory state and the deep sense of physical relaxation that follows. The net effect, neurochemically, is a substantial downregulation of the sympathetic nervous system, the fight-or-flight system that, in chronically elevated form, drives so much of the inflammation we see in modern aging men. Why does this matter for your prostate? Because chronic stress elevates cortisol, and chronically elevated cortisol is associated with systemic inflammation, including inflammation in prostatic tissue. So when regular ejaculation reduces cortisol and shifts the autonomic nervous system toward parasympathetic dominance, the prostate is one of many tissues that benefits indirectly. The mechanism is not direct hormonal action on the gland. It is the broader anti-inflammatory effect of a calmer nervous system. There is also a sleep dimension here that I think is meaningfully underappreciated. The post-orgasmic neurochemical state, particularly the prolactin and oxytocin release, promotes sleep onset and may improve sleep quality in some men. And sleep, gentlemen, is when prostate tissue repair happens. It is when growth hormone is released. It is when inflammation resolves. A man who is sleeping well is a man whose prostate is being given the conditions it needs to maintain itself. A man who is chronically sleep-deprived is a man whose tissues, all tissues, age faster. I had a patient named Theodore, age 61, an attorney with a punishing schedule and the kind of chronic background stress that comes with 30 years of high-stakes litigation. Mild urinary symptoms, PSA borderline, sleep fractured. We did not put him on additional medication. We restructured his evenings, a slower wind down, less screen exposure after 9, and yes, a more regular ejaculation pattern integrated into his bedtime routine rather than as an afterthought. 3 months later, his sleep was measurably better on the wearable he used to track it. His urinary symptoms had quieted, and his PSA had drifted back into the unambiguously normal range. Was the prostate effect direct, or was it downstream of better sleep and lower cortisol? Almost certainly both. The systems do not operate in isolation. They never have. Let me now offer the framework I give to my patients over 50 when this topic comes up. In terms of frequency, daily is appropriate for most men in this age range, though 5 to 6 times per week is equally protective and may suit individual rhythms better. There is no clinical benefit to forcing a higher number. The biology is not linear. More is not better past a certain point. The protective threshold appears to be reached at roughly 4 to 5 ejaculations per week and plateaus from there. In terms of technique, proper lubrication every time, a lighter rather than firmer touch, variety rather than repetition. In terms of duration, give the process the time it deserves. The full physiological benefit requires the full arousal cycle, not just the end point. In terms of partnership, if you are in a relationship, this practice should complement, not replace, intimacy with your partner. The research does not distinguish between partnered and solo ejaculation in terms of prostate outcomes. Both confer similar benefits. But human beings benefit from connection in ways that no single physiological metric can capture. And in terms of self-awareness, pay attention to your body. If something hurts, change something. If something feels compulsive rather than chosen, examine that honestly. The goal is informed, conscious, regular care of your body, not mechanical repetition. Now, as we close, I want to leave you with this. There is no shame in understanding how your body works. There is no virtue in ignorance and no weakness in curiosity. The men who age well are almost universally the men who pay quiet, honest attention to their own biology. You do not need to announce this to anyone. You do not need to discuss it with your friends, your golf partners, or your brother-in-law. You can simply start, quietly, consistently, with the information you now have. And one morning, somewhere down the road, at your next PSA check, or at your next physical, or simply on a Tuesday when you notice you slept better than you used to, you'll realize it's working. So here is my challenge to you. One change, 21 days. It might be using proper lubrication for the first time. It might be slowing down. It might be having an honest conversation with your partner. It might be scheduling that overdue urology appointment. Drop your one commitment in the comments below. Be brief, be discreet, but be real with yourself. This is Dr. Jocelyn. Stay informed, stay curious, and take care of the body you have. I'll see you in the next one.